COVID-19 self-test using a lateral flow device LFD kit. In this video we will talk about why people should regularly test for COVID-19, what a lateral flow LFD test kit is and how it works, how to get a self-test kit, what is inside an NHS test and trace self-test kit, how to do a self-test, how to report your results to the NHS, what to do if you receive a positive, negative or void test result. Why should people regularly test for COVID-19? Many people with coronavirus, COVID-19, have mild or even no symptoms, but can still spread the virus. With regular self-testing, we can slow the spread and help protect the most vulnerable in our families and communities. About 1 in 3 people who have COVID-19 are symptom-free. So testing with LFD kits is an important way of discovering positive cases that wouldn't otherwise have been found. In conjunction with the vaccine rollout, testing will help prevent the spread of COVID-19 by identifying and breaking chains of transmission. Furthermore, by testing on a regular basis, people are looking after the health of themselves, their family, their friends, and others around them. Testing must be accompanied by the appropriate actions, such as reporting all results, self-isolation if receiving a positive result, in order to have any meaningful effect. What is a lateral flow device test? The test for people without coronavirus symptoms is called a rapid lateral flow device test. This is sometimes referred to as an LFD test, or a rapid antigen test, or a lateral flow test, or a rapid self-test. This type of test usually involves rubbing a long cotton bud swab over your tonsils, or where they would have been, and inside your nose. This swab is then mixed with a special fluid, then a couple of drops of this fluid is placed onto the test device. The device has an absorbent pad at one end and a reading window at the other. Inside the device is a strip of test paper that changes colour in the presence of COVID-19 proteins, antigens. The test can give you a result in 30 minutes and do not need to be sent to a lab. You can do a rapid self-test at home or have an observed rapid test at a community testing site. If you test positive, you and anyone you live with will need to self-isolate and follow government guidelines. How do people get self-test kits? If you are over 18, you can receive your kits in 2 main ways. 1. Collect test kits. 2. Order online. Collect test kits. You can collect self-test kits at a local collection point. Each pack contains 7 tests. Anyone 18 or over can collect. You can check online if the location is open or busy before you go. You do not need to make an appointment. To find your nearest home test kit collection point, please go to maps.testandtrace.nhs.uk. Order test kits online. You can order self-test kits containing 7 tests for home delivery. Your tests should arrive within 2 days and can be ordered by going to www.gov.uk/order coronavirus rapid lateral flow tests. What is inside a self-test kit? The NHS Test and Trace self-test kit contains packaging, extraction tube holder, instruction booklet, extraction tubes, waste bags, swabs, lateral flow device test strips, extraction buffer sachets, but some kits are different, so always check and read through the enclosed instructions. How do you do a self-test using an NHS Test and Trace COVID-19 self-test rapid antigen test kit? Please note, if you have problems with your hands or vision, you may need someone to assist you with the swabbing and testing process. Avoid eating or drinking for at least 30 minutes before doing the test to reduce the risk of spoiling the test. All items in the test kit can only be used once, so please do not reuse them. You will need to report your result each time you take a test. Children under 12 should be tested by an adult. If you are testing a child under 12, there are slightly different guidelines. So please refer to the information booklet within your self-test pack. Before unpacking the test kit contents, you should clean the surface you are going to use. Open the packaging and lay out all items in front of you. Once the self-test kit is unpacked, place in front of you 1 test strip, 1 extraction tube, 1 extraction buffer sachet, 1 waste bag, 1 swab, and the extraction tube holder. Read the instruction booklet, ensuring you have all necessary testing equipment and that you understand the steps for the test. Before opening an individually sealed test strip, sanitize or wash your hands. Take the test strip out of the sealed packaging. Put the extraction tube into the cardboard vial holder. Twist the top of the extraction buffer sachet fluid and squeeze the fluid into the extraction tube. Be careful to avoid touching the sachet against the tube. Put the sachet into the waste bag. Gently blow your nose into a tissue and throw the tissue away. Then afterwards, wash or sanitize your hands. Find the swab in the sealed wrapper and identify the soft fabric tip of the swab. Open the swab packaging at the opposite end of the soft fabric tip. Do not touch the soft fabric tip of the swab. Now, you need to hold the swab between your fingers, open your mouth wide and rub the fabric tip of the swab over both tonsils, or where they would have been if you've had them removed. Do this with firm contact, 4 times on each side. Make sure that the fabric tip of the swab does not touch your teeth, tongue, gums or face, Put the same swab into one nostril until you feel some slight resistance. Insert about 2.5 centimeters or about 1 inch. This may feel uncomfortable, which is normal. However, do not insert the swab any deeper if you feel pain or strong resistance. If you have a nose piercing, swab the other nostril. If pierced on both sides, remove the piercing on one side before swabbing. Roll the swab 10 times slowly along the inside of the nostril. If you have had a nosebleed within the last 24 hours, swab the other nostril or wait 24 hours. Pick up the extraction tube into which you have poured the fluid from the sachet earlier. Put the swab into the fluid and press the tip of the swab against the edge of the extraction tube with force. Whilst doing so, rotate the swab around the tube for 15 seconds. After 15 seconds, pinch the extraction tube against the swab as you remove it, making sure all liquid is removed from the tip of the swab. Put the extraction tube back into the extraction tube holder while you dispose of the swab into the waste bag. Press the cap tightly onto the top of the extraction tube to avoid any leaks. Gently squeeze 2 drops of fluid from the extraction tube onto the specimen well on the test strip. The specimen well is marked on the test strip by an S. Check the time and then set a timer for 30 minutes. After the timer is set, you can now dispose of the extraction tube into the waste bag. Make sure you wash or sanitize your hands after completing the swab and testing process, and after handling any waste. Waiting the full 30-minute development time before you read your result is very important. A positive result can appear at any time after 20 minutes. However, you must wait for the full 30 minutes to record a negative result, as the test line, T, may take this long to appear. You will see the control line, C, begin to develop after about 4 minutes. You must wait 30 minutes before your result is ready. Do not leave the test to develop for longer than 30 minutes, as this will make the result void. The test strip should show one of these results. How to report your result. You must report your results to the NHS. You can register your result at www.gov.uk/report-COVID-19 result, or by telephone 7 AM to 11 PM, England, Wales and Northern Ireland on 119, free from mobiles and landlines. Scotland on 0300 30 32 713, charged at the standard network rate. The fastest way to report your result is by using a smartphone to scan the QR code at the top of the test strip. If you do not have a smartphone, you can record the result using the ID number below the QR code on the test strip. If reporting the result online, follow the on-screen prompts. Once you have reported your result, dispose of your used test kit. Pack back into the test kit packaging the things you did not use, and clean the area you used to conduct the test. What do the different test results mean? There will be 3 possible outcomes to your rapid self-test: positive, negative, or void. Depending on the result, there will be different things you need to do. Positive rapid lateral flow test result. A positive result means it's likely you had coronavirus, COVID-19, when the test was done. You and anyone you live with should self-isolate immediately. Get a PCR test, a test that is sent to a lab, to confirm your result. Continue to self-isolate until you get the result of the PCR test, and follow the advice you're given when you get the result. Negative test result for coronavirus. A negative result means the test did not find signs of coronavirus, COVID-19. You do not usually need to self-isolate if you get a negative result, but this does not guarantee you do not have coronavirus, so you must keep following all social distancing advice. When you need to keep self-isolating. You need to self-isolate for 10 full days if you get a negative test result and someone you live with has tested positive, someone you live with has symptoms and has not had a test. You've been told to self-isolate because you've been in close contact with someone who tested positive. You had a PCR test, a test that is sent to a lab, because you had a positive rapid lateral flow test and there were more than 2 days between the tests. England only. Coronavirus test sample could not be read. Void. If your test sample could not be read or you got a void result, it's not possible to say if you had coronavirus, COVID-19, when the test was done. Do another test as soon as possible. You can do another home test if you have one, or get a PCR test to check if you have coronavirus. Please visit the Norfolk County Council website for more information at www.norfolk.gov.uk/care support and health/health and wellbeing/adults health/coronavirus.